Come in.
Hello, sir. Good evening. How are you today?
I'm fine.
Sir, allow me to introduce myself. I am Jackson Pablo, the assigned nurse for today. And can you please state your name, sir?
My name is Marcos Bolivar.
Your birthday?
September 17, 2000.
Your age?
21.
Okay, thank you. So, sir, the purpose of this assessment is all going to examine your head to your neck, and it requires to touch these parts: your ears, your eyes, your nose, and your mouth. Is it okay to you, sir?
Yes, it's okay.
Okay, thank you. But before that, let me first close the door for our privacy and safety. Okay, sir, may I know, do you have any health history like hearing loss, vision problems, or nose problems?
None.
Okay, thank you. Let's do the assessment. Let's start to your head. I will inspect your head. Okay, so far I don't see any discolorations in your skin. And your eyes to your ears is in the same level. Okay. So the next step, I'm going to assess your cranial nerve number 7, your facial nerve check. May I ask you, sir, can you please close tightly your eyes? Okay. And smile for me. Frown. Puff off your cheeks. Okay, thank you. I'm going to palpate later your head, but before that, let me first disinfect my hand to avoid the spread of microorganisms and bacteria. Sir, I'm going to palpate your head now. The sides, into the back. Okay, I will do also the inspection of your hair. Okay, so far I don't see any infestations like lice, parasites, or any lesions in your hair. Okay, take your beard. Okay, so far I don't see any discolorations in your hair and lesions. Okay, thank you. Okay, sir, the next I'm going to palpate your temporal arteries, your masseter, okay, your mandibular resistance. Okay, thank you. And let's do the cranial nerves number 5, your trigeminal nerve. I'm going to do this one, and I want you to close open your mouth to assess your mandibular joints. Okay, so far I don't feel any grating and clicking in your mandibular. Okay, sir, the next part of this assessment is I'm going to palpate your sinuses. I'm going to palpate your maxillary. Do you feel any pain, sir?
None.
Okay, your frontal.
None.
Okay, thank you. And the next things that I will do is I'm going to assess your eye, and let me first inspect your eyes using pen light to see if there are any lesions and discolorations in your eyelids and sclera. Okay, so far I don't see any bad things. And the next, I'm going to assess you about the 6 ocular movements of the eyes using pen. So the distance between this pen to your nose is at least 12 to 15 inches away. And what I want you to do, sir, is follow the directions of this pen and steady your head. Okay, let's start. Okay, thank you. Okay, sir, let's move on to the next part of the assessment. But before that, let me first disinfect my hand. Okay, I'm going to inspect your ear using this pen light. Okay, so far I don't see any abnormalities or discolorations in your ears. Okay, next I'm going to palpate both ear. Okay, so far I don't see any muscle tenderness or any abnormalities in your ear. Okay, so the next I'm going to assess you the cranial nerves number 8, and I'm going to place my hand here, and I'm going to whisper some numbers here, and I want you to relay those numbers to me louder. Okay, let's start, sir.
64, 25, 99,
Next.
55, 11, 69.
Okay, thank you. Okay, so the next part of this assessment, I'm going to inspect your nose. Okay, I'm going to press this part, and I want you to release some air. Okay, the other one. Okay, thank you. And I want to inspect also the inner of your nose using this pen light to see any drainage. Okay, so far I don't see any drainage or discolorations of your nose. Okay, I don't see any problem. So the next, what I want you to do is close your eyes, and I'm going to put some objects in your top of your nose, and I want you to guess this object using your sense of smell. Okay, let's start, sir.
Alcohol,
Okay, next.
chocolate,
Okay, thank you, sir. I'm going to inspect your mouth now. Let's start with your lips. Okay, nice color of your lips. I don't see any soreness. That's good. Sir, may I ask you this? Can you please stick out your tongue and move side by side? Okay, thank you, sir. So this time I'm going to use this tongue blader to inspect the inside of your mouth. Can you please open your mouth, sir? Okay. So far I don't see any cavities in your teeth. I don't see any soreness. The color of your mouth is still good. Okay. Thank you, sir. So, sir, we are going to do now the last part of this assessment, the inspection of your neck. But before that, let me first disinfect my hand to avoid the spread of microorganisms and viruses. Okay, sir. Let me inspect your neck. Will you head up? Okay. So far, I don't see any discolorations and lesions, and I don't feel any lumps or goiter in your head. Next, I'm going now to do the cranial nerve number 2, the accessory nerve. What I want you to do is move your head to the side, and to the side, and to the up, and to down. Okay, let's do. The other side. Okay. Okay, sir. Down. Head up, sir. Going to see if there are any distinction in your jugular vein. So far, I don't feel any distinction. Thank you. I'm going now to palpate your trachea, sir. To confirm if it is in the midline. Do you feel any tenderness, sir, or anything?
none,
So far, I don't feel any lumps also. Now, I'm going now to palpate your lymph nodes. And tell me, sir, if you feel any tenderness. Okay, let's start to your preocular.
none,
Okay, to your postocular.
none,
To your occipital.
none,
To this part.
None.
To this part.
None.
Okay. Now I'm going to palpate your carotid artery to the sides and to the sides. Okay. So far I don't see any abnormalities. Now I'm going to use the bell of the stethoscope to auscultate your carotid artery. Okay, and what I want you to do, sir, is I want you to breathe in and out and hold. Okay, let's start to this part. Okay, good. This part. Okay, thank you, sir. Okay. So, based on the assessment of the head to neck, I don't see any abnormalities or defect in your body parts, and the findings normal, sir. And thank you for your cooperation, and have a nice day, sir.
Thank you.
Thank you.